On today's Two on Your Side Town Hall, the state of the pandemic in Western New York. We're going to talk live with a local infectious disease expert about rising cases, concerns at schools, and treatments that some people think may help end the pandemic. Plus a question for the Verify team about the safety of wireless headphones and some reassurances from trusted sources. And how the lessons learned from the pandemic can help restaurants looking at the long winter ahead. Good evening to you, everybody. Kate is off tonight. We're going to start with the news that brought Governor Kathy Hochul here to Western New York earlier today. The troubling surge in COVID cases in our area specifically. Western New York for a while now has had one of the highest test positivity rates in the state. The 7-day average you can see is now above 8%, more than twice the state average. We've seen a big increase this month in particular. It's higher now than at any point since January. That's when we were coming down from last winter's surge. Hochul's message today was one of concern.
A lot of it's concentrated in our rural areas. We're very aware of that. There is a direct correlation between people being vaccinated and the infection rate. So the numbers are getting up there. We'll eventually hit 90%, but it's that 10% that's holding everybody back. That's what's so frustrating about this. It doesn't have to be that way.
So what's behind the surge and what's ahead for us? Joining us live right now is Dr. Thomas Russo, Chief of Infectious Diseases at UB's Jacobs School of Medicine, live here in studio for the first time in a long time. Dr. Russo, it's great to see you.
Yeah, great to be with you, Michael.
Yeah, it's been a while. First off, this does really seem like deja vu. 1 year ago, the cases were starting to spike right around the start of November after a summer where we saw things improve quite a bit. The difference between then and now, though, is that we have access to this vaccine. Nobody had the shots a year ago. Now a lot of people do. So people are asking, what is behind the surge right now? What is your guess on that?
Well, there's multiple factors in play here. The first, and it's no coincidence the cases are going up again this time of year, is this getting cooler. We're heading indoors, and that's where the virus spreads particularly well. And although we've gotten a significant proportion of the population vaccinated, we've only got 63% of individuals that are fully vaccinated here in Western New York and Erie County, and you need both shots to have optimal protection against this extraordinarily infectious Delta variant. The other factor I think that's really contributing to this most recent surge, besides us heading indoors, is individuals that are yet to be vaccinated but were infected in earlier waves, the pre-Delta waves of this pandemic, who think they're good because they have some immunity from that prior infection. That immunity is likely waning and they're having increased susceptibility. And then lastly, even our fully vaccinated individuals that were first in line, vaccinated back in December, in January and February, the vaccine is losing a whiff of luster. So getting that booster shot will be critical for optimal protection for those individuals.
And on that note, Governor Hochul said today that everyone who has been vaccinated in Western New York should get a booster shot as long as you're 18 years old. That is not what the CDC and the FDA are saying yet. What do you think of this idea that if you're 18 and older, go ahead and get a booster?
Well, I think Governor Hochul is spot on, and I don't really think that advice is non-congruent with what the CDC is saying. CDC says that anyone that interacts in situations that put you at high risk for getting infected would be eligible for the booster. And we have an extraordinarily high infection rate here in Western New York and in Erie County. So I think that it's a great idea to get those booster shots in arms. It's not only going to be increase the degree of protection for those individuals, which is critically important, but it's going to help break that chain of transmission and hopefully tamp down cases here.
Dr. Russo, I want to talk to you about what's happening in our hospitals. We've reported on how they are, kind of getting full at the moment. People getting sick enough to where they need that level of care. I want to show our viewers here, we're now just shy of 300 hospitalizations for our 5-county region. It's up 40% over just the past 2 weeks, almost double what we were a year ago. And again, back then we didn't have vaccines available. I've heard from a lot of viewers suggesting that this shows the vaccines don't work that well, arguing that it's evidence that we shouldn't require them of people because some vaccinated folks are also ending up in the hospital. I wonder if you can speak directly to those people. Will the vaccine help keep you out of the hospital?
The vaccines unequivocally will help keep you out of hospital. and would be in a terrible situation right now if we didn't have approximately 2/3 of our population vaccinated. We're seeing those hospitalizations go up, which are primarily the unvaccinated. Though there's a few individuals that are fully vaccinated that might not have had an optimal response and have a little bit of waning, they really represent the minority of individuals that are in hospital. So the secret out of this pandemic, and this is old news, but just to reiterate it, please get vaccinated. If you're unvaccinated, even if you've been previously infected, you probably have some waning immunity and you're at risk. So that's what we need to do to keep our hospitalization numbers down. And then lastly, you know, we've been a little lax with some of our public health measures, such as mask use indoors. I think we really need to get a little bit more stringent with that. People need to take it upon themselves when they go in grocery stores, retail stores. Please wear those masks while you're waiting to get vaccinated. Even if you're fully vaccinated, that's also going to help keep these cases down, which in turn will keep hospitalizations down.
Couple of quick final questions. We asked our viewers today in an unscientific online poll if the rising cases should lead to a return to some more remote learning like we saw last year. People can still go to WGRZ.com/vote and weigh in. The response was heavily on the side of no. How would you answer that?
Well, I think we need to keep our schools open and our children in school. We obviously had a huge loss of an educational opportunity last year. And we know in schools that if we execute with all the mitigation measures in place, there isn't a whole lot of transmission within the schools themselves. Lots of that transmission is occurring in extracurricular activities, children gathering outside the school venue where masks might not be optimally used. So yes, I would vote to please keep our schools open. It's critically important face-to-face learning at this point.
Yeah, absolutely. All the research thus far has shown that. Finally, we mentioned just a half hour ago, first at 5, that Pfizer has now applied for FDA approval for its experimental COVID treatment pill that it says helps prevent hospitalization of people who get infected as long as you catch it early on. Merck has something similar. Now, these aren't approved yet, but if we continue vaccinations and then we have these pills to, keep almost 90% of people out of the hospital, can we end this pandemic even though we won't eliminate the virus?
Well, I think these new outpatient treatments in the form of pills are going to be extraordinarily important, and we've been waiting for these for a long period of time. Now, to be clear, this is no reason not to get vaccinated. It is always better to go ahead and prevent a particular disease than go ahead and treat a disease. And to have that effect that you mentioned, Michael, you do have to be treated fairly early on. That data from Pfizer is within 3 days of infection, and data from Merck is within 5 days of infection. And so some people might not have that same degree of protection and be within that early window. But there's no question this is going to help so that those people, whether unvaccinated or people that have breakthrough infections that are fully vaccinated, if we have an oral treatment that could minimize hospitalization, obviously that's going to be a huge help.
Dr. Thomas Russo is Chief of Infectious Diseases at UB's Medical School. We touched on a lot of topics. Thank you so much for coming in, and it's good to see you in person.
Yeah, great to be here, Michael. Thank you.
All right. Thank you for all you've done over the past couple of years now, almost. All right, we're going to move on now on the town hall as we keep a close eye on the economy. It is that time of month that we look at retail sales. It's an important indicator, especially with high inflation. NBC's Stephanie Ruhle joins us right now from New York City. She's been digging through the monthly report that came out this morning. Even though things are more expensive, that doesn't seem to be driving down spending, it appears. Stephanie.
Hey there, retail sales numbers are out as well as earnings from some of the biggest retailers in the country, and they're giving us some particular insight into how the American consumer is doing. And what do we see from this? Well, retail sales were up 1.7% in October from the previous month, up over 16% from where we were last year. And this tells us prices are high, consumers don't like it, however, we're out there spending. We are paying these higher prices. And for some Americans, they can afford to. Household savings hit a record high since the pandemic began. And for wealthier Americans who were able to work from home, who maybe owned their homes, had some investments in the stock market, they have seen their savings go up, and now they've got this pent-up demand, and they're paying these higher prices. For those who are more economically vulnerable, this has been very difficult. For people who live paycheck to paycheck, they have seen their wages increase, but everything they need to buy, whether it's gas at the pump, groceries, or sneakers for your kids, it's getting more expensive and tougher to buy these things. And for those who are middle-income savers, well, with interest rates at zero, you're not earning on those savings. So while we are clearly in an economic recovery and these retail sales numbers are very good, it certainly doesn't feel good for Americans. Consumer sentiment, how we feel, has reached a 10-year low. All of this painting a complicated picture in an economic recovery.
Great explanation, Stephanie Ruhle, with that report from New York City. Thank you.